Yes, so we are back with Sandeep again, and we are doing a PRP for him, right? Now, Sandeep, you've got a transplant done, right?
Yes.
Why are we doing a PRP? Can you
Just
know
to-
it all?
yeah,
so
yeah,
it's better
yeah.
if you speak. Yes.
So basically, PRP is done to retain the hair, and yeah, of course, to strengthen them, to retain the existing hair.
Right. And has it helped you out?
Yeah, a lot.
Yeah. So many people have a question that how much of pain do you get in a PRP treatment? So I'm currently doing it on you. If you were to give me a score from 1 to 10, what would that be?
I would say it is not. I mean, it's not painful at all. As you can see, PRP is being injected at the moment, and I'm not even feeling it. Right, so I'm comfortable.
Right.
It's like an insect bite.
Right.
I don't even feel it.
And do you have any side effects of this PRP treatment?
No, not at all. So
Not at all?
my first PRP was 14 months ago when I got my transplant done. So I'm yet to encounter any negative impact of it.
Right. And how has been the entire journey since 14 months? You got a transplant done, you've been doing a PRP. Have you seen any side effects or any adverse effects from these procedures?
Not at all. I've been taking my medication regularly, so a lot of people have this apprehension about the medication which is being prescribed.
Right.
So absolutely, there is no side effect. I have been taking it myself for the last 14 months,
Right.
and I have not yet observed any side effects. So it is absolutely safe. Just make sure that you.
And how early did you start seeing a transformation after a hair transplant?
So I mean, it took me a while. So for first 3 months, the transplanted hair started shedding, and after 6 months, I would say probably the transplanted hair started sprouting, and things started getting better after 6 months.
After 6 months, right?
Yes. So for first 3 months, the transplanted hair started shedding.
Right.
Yeah.
Correct. So yeah, that's the normal timeline of a hair transplant.
Correct.
So yes, I think I think a lot of credit goes to Sandeep for being committed to a good protocol of PRP, of medications to retain his existing hair, because the transplanted hair that you see out here, they look very natural. They are not going to go anywhere. Yeah, but the existing hair may continue to go if you do not take care and you do not try to control the genetic hair loss which is happening in this case. Am I right?
Correct.
Yeah, and I
Correct.
think your commitment has done the trick for you.
Yeah.
And I tell this to all my patients.
Correct.
It is not magic that I do. Yeah, it is much to do with how you're committed and how much you make an effort towards your
On
hair.
top of it, I would also like to say something about the Musk, and of course, about you also, because a lot of credit goes to you also, because when I thought of getting something like this done, I was very apprehensive. I went to a couple
Right,
of
I
places.
remember that. Yes.
Yeah, I was very apprehensive. I went to a couple of good places in Ahmedabad for consultation, but of course, the consultation I went to other places were not convincing enough. But when I came here, the consultation was good. I just thought of getting it done immediately, and from there on, the journey has been pretty good. So
The basic purpose of any consultation with a hair transplant or any cosmetic treatment is to match your expectations from the procedure. Yeah.
Correct.
I mean, my procedure can be 100% success, but if it does not match your expectations, then it could be a failure to you. So
Absolutely.
it is very imperative that
Yeah,
in a
because-
consultation process, we try to match the patient's expectation with what I can deliver.
Yeah.
And it's always better to under-promise. Am I right?
And
Yeah.
over-deliver.
And over-deliver.
Correct.
Yes. So you're happy at the end of the day?
Absolutely,
And you
absolutely.
think you did the right decision by undergoing
Absolutely,
a
I highly
hair
recommend Musk for hair transplant.
Right. I'm so happy. Thank you.
Thank you.
Yeah,
Thank
we're
you.
glad.
Yeah, thank you.
Thank you.